Hello, I'm Stefan Mabry, a PhD student at the University of North Dakota. Today, we will examine key papers, research gaps, and a proposal for future research directions surrounding automated testing within interoperability in the healthcare industry. Specifically, our focus is from the point of view and interests of a large health system. Some background on the state of data exchange in the healthcare industry. Healthcare data is growing faster than any other industry, driven by the complexity of its ecosystem. Imagine a healthcare system with countless applications, each built by different vendors, running on different technologies, and designed to serve unique needs. These systems need to communicate seamlessly, but the diverse configurations create a huge challenge. Integrating these systems is like trying to fit together puzzle pieces from different puzzles, all while managing the unique demands of each hospital or clinic. At the same time, healthcare data is exploding. As of 2020, it accounted for 2.3 zettabytes and is growing at the astounding rate of 36% annually. But even with this vast amount of information, much of the data is fragmented or unstructured, making it difficult to access, standardize, and use effectively. To make matters even more complicated, healthcare has historically been slow to adopt new technologies compared to other industries like finance or retail. This lag puts even more pressure on solving interoperability issues as the volume and complexity of data continues to grow. Here are some key concepts you should be familiar with through this discussion. Healthcare interoperability involves the seamless exchange of data across systems, which can be categorized into 3 levels. There's foundational. This level allows one system to receive and exchange data with another, ensuring basic connectivity. There's structural. At this level, the structure and format of the data are preserved as it moves between systems, maintaining consistency. And then there's semantic. This is the highest level of integration. It enables systems to not only exchange data, but also interpret and understand it using standardized terminology, ensuring that the meaning is consistent. Data is integrated into care processes, business operations, and patient workflows at this level. Achieving this is the ultimate goal, but it remains challenging. Additionally, some other terms, electronic health records, or EHRs, are systems that store patient information. They play a critical role in interoperability efforts. And then key standards for facilitating interoperability include HL7 and FHIR. FHIR is FHIR, which define the structure and exchange mechanisms for healthcare data today. Other terms you should be familiar with are data standardization, which pushes data to conform to existing standards. Structured data is data that is well organized, while unstructured data, like clinical notes, lacks a defined format. And finally, APIs are your program interfaces, such as HL7, FHIR. There's others like CCDA and DICOM. But why is healthcare interoperability important? Without interoperability, healthcare systems suffer from fragmented care where patient data remains siloed, resulting in incomplete records. This lack of access can lead to misdiagnoses or mistreatments, endangering patient safety. Additionally, poor data exchange contributes to increased medical errors, which including medication mistakes and also unnecessary duplicate testing. These errors, alongside repeated procedures, drive up the costs for both patients and healthcare providers. The consequences extend to worsen patient outcomes, as delays in accessing comprehensive data hinder timely, life-saving decisions. Clinicians also face inefficiency and burnout, spending too much time gathering data manually. However, with interoperability in place, these issues improve dramatically. Seamless data sharing ensures complete patient records, reducing errors, cutting costs, improving care quality, Clinicians can focus on delivering care rather than hunting down information, which leads to better outcomes and greater system efficiency. So why should we research automated testing on interoperability in healthcare today? So this is the history of kind of like healthcare interoperability. Interoperability is a critical issue today, despite EHRs being developed over 60 years ago. The early versions of EHRs were isolated systems used by select institutions like the Mayo Clinic, but true data sharing and integration across health systems remained out of reach. It wasn't until the High-Tech Act of 2009 infused billions of dollars into the healthcare industry that EHRs became a common feature across health systems. However, widespread EHR adoption didn't immediately lead to interoperability. HL7, a communication standard introduced in 1987, was an important step, but it wasn't until 2012 when the Office of the National Coordinator for Health Information Technology, or the ONC, began pushing for the standardization of data exchange with HL7. Even so, HL7 struggled with real-time data transfer, leading to the creation of FHIR, which stands for the Fast Healthcare Interoperability Resources, that was released for general consumption at the end of 2019, which provided a web-based API for real-time data sharing. However, due to the costs of redevelopment, many health systems are slowly transitioning from their HL7 interfaces to the modern RESTful web API of FHIR today. 6 years later, FHIR is starting to gain dominance and slowly becomes feature complete. One important point: most of these health tech companies, especially the EHRs, do not want to be harmonious with each other. It wasn't until 2020 that the CMS Interoperability and Patient Access Rule was enacted, and through regulations and laws, health tech companies are now required to open their patient information to each other, and this opening must be tested and certified by the ONC. This requirement, along with the demands on health systems, are the principal driving force for interoperability today. So in summary, FHIR is new, and that's why we should study it today. The primary challenges in research for healthcare interoperability are the user-centered design, which is about creating seamless user experiences for healthcare providers, thereby reducing physician burnout and improving patient outcomes by simplifying system interactions. Interoperability is critical in this area to create seamless transitions from one application to another within a single workflow. Semantic interoperability, which is the ensuring that data from one application can deeply interact with systems downstream. This is critical for comprehensive patient care and effective decision-making by clinicians with modern decision support tools. Third, cybersecurity. Healthcare is the most targeted industry for cyber attacks, and improving security is essential to protect sensitive data, as interfaces can be vulnerable points of entry. Also, automated testing with or without AI assistance is the future of creating a resilient technology ecosystem. And then finally, testing and validation. This is the focus of this study. Proper testing is crucial for preventing errors that could lead to inefficiency, financial loss, patient harm, or even death. I began this study with one primary survey question and two supporting ones. First, I wanted to explore what automated testing strategies have been researched for interoperability in industries outside of healthcare. These strategies may serve as models for healthcare, though we must be cautious as the complexity of healthcare data may make direct application difficult. Second, I sought to understand what has already been studied about healthcare interoperability. These studies help illustrate the importance of this research area and also provide insights on how automated testing could be utilized. And then finally, my main research question focused on automated testing within healthcare itself. What has been done, where are the gaps, and what directions does research suggest for future study? I had 7 criteria for selecting studies, and I ranked them by their influence on inclusion. The most critical criterion was relevance, whether the study directly addressed one of my 3 guiding questions. Next, only high-quality journals were considered, ensuring studies were drawn from respected publications. Also, papers needed to be published post-2009, the year that the HITECH Act was enacted, as interoperability concerns took shape primarily after electronic health records became widespread. The remaining 4 criteria acted as influencers. They boiled down to a simple question: how much can I trust this paper? Without the depth, rigor, innovation, or citations to support its findings, the paper was excluded from the study. My survey methodology involved conducting searches across multiple databases. IEEE was critical. Also, PubMed and Google are ones that included studies from. They're aggregators. PubMed being for the healthcare industry. The key research terms were healthcare interoperability, HL7 automated testing, healthcare interoperability automated testing, FHIR testing, RESTful API automated testing. I reviewed the titles, I scanned the abstracts to identify relevant articles that were published after 2009, reflecting that post-HITECH Act era, which saw that huge surge of EHR adoption and interoperability challenges that stemmed from that. From this, 74 articles were selected for that deeper review. And then upon that deeper review, 27 papers were chosen, categorized into one of 4 groups. And then I critically analyzed the remaining papers, those remaining 27 papers, looking for the trends, the research gaps, and the weaknesses of the studies. And finally, I developed our research direction and refined research questions utilizing this careful review. And here are the 4 groups that papers were sorted into. The first one being healthcare interoperability papers. They focus on explaining how interoperability works in healthcare, its importance, and suggestions for improvement. Second, the automated testing non-healthcare interoperability papers that discussed automated testing strategies from other industries. Examining those led to how they could be applied in the healthcare. The third category is the testing healthcare interoperability, but not automated testing. They include papers on strategies and tools for testing that healthcare interoperability without that automation. And I use those to determine where automation processes could fit into. And then finally, the most crucial gap is the automated testing in healthcare interoperability, containing papers dedicated to applying the automated testing methods specifically within the healthcare ecosystem. So that's the point of this study. This classification helps streamline the analysis of trends and gaps in the healthcare interoperability testing. So in the study, I found 74 papers through the search terms, of which 27 met the inclusion criteria upon deeper review. Among these, only 3 papers specifically addressed automated testing within healthcare interoperability. And these 3 were focused only on 2 standards, HL7 and CCDA, which is it exchanges documents like consent and like power of attorney. This analysis highlights the research gaps, particularly in the realm of automated testing for healthcare systems. It's a critical need given the complexity of healthcare interfaces. While many studies examined the healthcare interoperability broadly or automated testing in other industries, relatively few have explored the application of automated testing specifically within healthcare. These gaps provide a clear direction for future research. I selected 5 papers to show how they might impact our survey. The first is Pope, who created a measure of trustworthiness of Internet of Things integrations. I think this might be a good foundation for similar measures more broadly in healthcare that could be used as like a smell test to determine risk of faults in interfaces. Bashir, who proposed a semantic web technology to structure clinical data for integration. And I wonder if this could help AI drive automated testing within healthcare. The third one is Wolanowski, who evaluated the impact of two industry tools that do testing of HL7 and FHIR today. These tools could be models for automating the testing within health systems. Numir designed a system that can test DICOM, which is the interface standard that exchanges imaging studies. This could be a model for future platforms that perform automated testing and approach interfaces more broadly than just DICOM. Zarfman then highlighted challenges for data quality that he encountered during the pandemic. And these lessons should be kept in mind while we explore automated testing solutions. Realistically, each paper in this study contributed to the overall gap analysis and future research directions. So this is the gap analysis, and they reveal 5 critical gaps on the current research on automated testing within healthcare interoperability. First, very few studies address automated testing for healthcare interfaces at all, with no coverage of automated testing for FHIR, which is that new real-time data exchange standard using web APIs. None of the reviewed studies employed standard testing metrics like coverage, fault detection, or defect density. Furthermore, no new metrics were proposed to measure testing quality in healthcare interoperability domain. And I'm talking like measures like clinical workflow accuracy, interoperability compliance, error coverage and detection rate, or patient safety impacts. Finally, only 2 industry testing tools were evaluated at all that I could find. Both services focus on like health tech companies testing their interface conformance to published standards, but they're not testing the functionality itself. And these 2 tools are not suitable for health systems, and they cannot be integrated into their unique ecosystems. So this leaves a significant gap in tools tailored for real-world healthcare environments. There's 3 main research directions that I identified in this study, and they highlight critical areas for advancing healthcare interoperability. First, there's a need for deeper exploration of automated testing of interoperability, focusing on applying existing technologies, or existing testing strategies, and then developing new healthcare-specific measures. Next, semantic interoperability remains a challenge, requiring improvements both in delivery and testing to ensure seamless data integration between systems. Finally, cyber resilience and AI are top priorities for ensuring healthcare technology remains secure against cyber threats, and automated testing could play a vital role in enhancing resilience across these systems. Together, these focus areas aim to push healthcare technology towards a safer, more efficient operation. So these are the research questions that I came up with from this study. There's quite a few of them. So this study uncovered key research questions that are crucial for advancing the literature, particularly in the context of newer FHIR-based standards released in late 2019. These questions span a wide range of areas, from semantic interoperability to AI and cyber resilience. But a pressing focus has been emerged around that automated testing framework. My next paper will address the question, which automated testing frameworks handle the diversity in healthcare systems when validating interoperability? This study will apply existing measures such as coverage and fault detection while developing new healthcare-specific metrics to better assess the ecosystem it serves. Here are some citations that you found throughout this presentation. And then these are the survey papers that I utilized within the study. The first 5 are the key studies that I highlighted, and then the rest of these are the ones that I included in the study but didn't talk about specifically in this presentation. This is normally where we ask for some questions. However, you can reach out to me here. This is my email address, or use the QR code to reach out to me on LinkedIn. And of course, if you want to visit Madison, Wisconsin, I'm here, and we can hang out, have a drink, and talk about testing. Thank you, and have a great day.